Whether your ticket is backyard gardening or hiking through the woods, summertime is outdoor fun time for many people. But along with fun comes safety risks. One risk often overlooked are poisonous plants that cover the Midwest, including poison ivy, poison oak, and poison sumac. For some people, contact with these plants can be a minor irritation, but for others, an outbreak can be serious and even deadly. I spoke to Justin Georges, a lifelong Midwest resident of Carthage, Illinois, about his experience with poisonous Midwest plant life. After reviewing the topic on the Medline Plus Trusted Health website, I asked him to tell me a bit about his experience.
I reviewed poison ivy, oak, and sumac, just kind of trying to find out what the differences are between those and just find more information about that.
There's a lot of health information on the web, so I asked Justin why this particular issue was important to him.
In the past, I've had a lot of experience with poison ivy, I think, and I don't really know the difference with what I've had and what symptoms have persisted for each one, whether it was poison ivy, poison oak, poison sumac. But I just know that I've gotten a bad rash, and it's been something that's bothered me every summer. Usually I get it once, pretty good, and then sometimes 2 or 3 times a summer, especially as a kid when I was in the woods a lot more than what I am now.
Most reactions are fairly minor and go away in a few weeks, but other people can have serious reactions, including major respiratory problems. I asked Justin if he had ever had a significant outbreak.
There's been one time I know in particular where I think I pretty much slept in it. I found out later on, and I ended up getting it all over my body.
Wow.
Pretty much head to toe. My face swelled up. My nose was like really oozy from it, and my eyes were pretty much swollen shut. I even got it in my throat. I was throwing up. I had to go to the doctor. I was out of school for pretty much a whole week.
Most times people get exposed to these plants, they don't even know it until they break out in a rash. Justin explained to me what happens when you come in contact with poisonous plants and how it spreads.
Well, really what I found was that you can't transmit it just by touching like somebody. So like say like I had it one day, I had the rash, and you touched the rash, you couldn't get it. And I always thought that you could spread that from person to person. But really it was the oil that comes directly from the plant is what you have to touch first in order to get it, to get poison ivy.
So did you find out any things that you can do to prevent coming in contact with it or getting the oil off of you so it doesn't spread afterwards? Or
wear jeans, don't have anything that's gonna you have your skin exposed, and change your clothes when you're out of the woods, and take a shower directly after. I've heard that dial soap has helped, and that was something else that I want to look on the website to find out if there's any specific kind of soap that works better than others.
After talking with Justin, I found out a lot I didn't know about poisonous plants, and I wondered if there was anything more he wanted to know about them.
Yeah, I'm definitely going to look into more about finding out about the immunities of it, because I've had friends who have claimed that they're immune to it when they were kids, and we would walk through the same areas, same parts of the woods, and I would get it, but they wouldn't get it. I did see on the website that in some cases when you become in contact with it for the first time, it doesn't bother you, but then like the next time it does. And so I want to find out more about how that affects other people.
I also asked him how he felt about the impact of these plants on living in the Midwest today.
Well, it definitely seems like that it's pretty prevalent in all areas, like forest areas in the Midwest.
This is the time of year when it can be either a serious irritant or very dangerous. So
I think in the springtime when we get a lot of rain and people are out looking for morel mushrooms, that's about the time when it's at its peak.
This project has been funded in whole or in part with federal funds from the National Library of Medicine, National Institutes of Health, Department of Health and Human Services, and with the University of Illinois Chicago. Let's make a better you. Midwest User Video Health Experiences.